How to overcome communication barriers with healthcare teams. Imagine sitting in a doctor's office feeling frustrated because you can't get your words across or understand what's being said. It happens more often than you think, especially for people with disabilities. When communication breaks down, it can affect your health care and your rights. So, how do you make sure your voice is heard and understood? Let's explore some simple ways to bridge those gaps and work better with your healthcare team. First, it's important to tell your healthcare providers how you prefer to communicate. Do you use pictures, written notes, or need an interpreter? Sharing this at the start of your appointment helps the team know what works best for you. Using a checklist or a form to note your preferences can make this process easier and ensure they are remembered for future visits. Next, ask if the healthcare team has training on communicating with people who have disabilities. Many health workers haven't received enough education on this. Learning about accessible communication methods, like the Accessible Information Standard, can help them understand how to better support your needs. If they are trained, they will be more confident and respectful when talking with you. It's also vital that your healthcare provider talks directly to you, not just your caregiver or family member. This shows respect for your independence and helps you stay involved in decisions about your health. When speaking, ask them to use simple words, avoid confusing medical language, and check if you understand what they are saying. If you are deaf or hard of hearing, communication might need extra tools. Sign language interpreters, captioning services, written materials, or amplification devices can make a big difference. Always ask if these aids are available and ensure they are provided at no extra cost. Sometimes, policies need to be adjusted to make sure everyone can communicate comfortably. Creating a calm, supportive environment also helps. Arranging longer appointment times, reducing interruptions, and providing a quiet space can make it easier for you to share your concerns. If face coverings are necessary, transparent masks can help you read lips and see facial expressions. Building trust with your healthcare team is key. Be patient, listen carefully, and share your experiences honestly. Trust makes it easier to communicate openly and get the care you need. If you feel your needs aren't being met, don't hesitate to ask for a different provider or advocate for yourself. When you can't speak for yourself, involving a trusted advocate or family member can help communicate your needs. But always try to speak directly to your healthcare team first. This keeps your voice at the center of your care. Finally, remember that laws like the Americans with Disabilities Act requiring healthcare providers to offer effective communication and reasonable accommodations. Knowing your rights helps you stand up for yourself and ensures you get fair treatment. To sum up, overcoming communication barriers involves sharing your preferences, asking about training, engaging directly with your providers, using helpful tools, creating a supportive space, building trust, and knowing your rights. When everyone works together, you can get the care you deserve and feel confident in your health journey.